Last week we talked about one of the most common sources of lower back pain, and that be from the rotation or twist in the pelvis or the sacroiliac joint. Today we're going to talk about perhaps one of the most serious and significant forms of lower back pain, and that be secondary to a disc injury. Now, whether that disc injury be called a disc bulge, a disc protrusion, a disc herniation, a disc sequestration, whatever the terminology, the mechanism behind the original injury remains the same. Now, that mechanism has been demonstrated by an anatomy lecturer from the University of New England in Newcastle. And they've identified that first and foremost, the only way that a vertebra can no longer sit on top of its disc evenly is if it moves directly backwards. Now, that's very significant for the Gonstead chiropractor because firstly, we focus our entire world on the relationship between the disc and the vertebra. And secondly, we are always considering the primary direction of misalignment to be backwards, or as we call it, posterior. In other words, the anatomy is demonstrating and validating the Gonstead mechanism of injury, which is so important for us to be able to correct. Now, to explain what the disc injury is all about, let's think of the disc and the vertebra much like yourself in a beanbag. If you sit yourself plumb center in the middle of a beanbag, you can wedge yourself down in there. Firstly, you're very, very stable. It's difficult to shift you off center. Secondly, your weight is distributed evenly throughout the disc. In other words, both you and the disc are doing their perfect job because you have an optimal relationship. However, if I ask you to sit on one edge of the beanbag, you become very unstable in your position. It's easy to dislodge you from that position. Secondly, is by pushing the beans to one side of the beanbag, over time you are going to create a stretch on the beanbag itself. That then allows the beanbag to start to bulge or to swell in that direction. That is the fundamental mechanism behind a disc injury. Now, when that bulges into the small space where the nerves exit, at times a disc bulge can cause direct local lower back pain. It can also cause pain, what we call radicular pain, all the way down the leg, examples of which might be sciatica. Now, it's particularly relevant here. A disc bulge will most commonly cause leg pain that is below the knee. Pain above the knee quite often is not from a disc bulge. It may be from some other source of injury in your lower back. However, the leg pain can be quite severe, and it is one of the most debilitating things that we see of patients who come hobbling into the practice is they can't weight bear because of the pain in their leg. They have excruciating lower back pain with associated muscle spasms, and they're typically locked in a position of forward flexion. It is a horrible thing to see for a human being. We have a mechanism by which we can help you, by which we can understand how the disc may be injured and therefore create some level of correction for you.